This section of the course will start with the basic anatomy of the heart and its functions, before moving on to look at some of the most common heart conditions. This will ensure you have the knowledge you need to deliver the course with confidence. So how does a healthy heart work? In a healthy person, the heart is responsible for supplying the body with oxygenated blood so it can function. This is a continuous process. On the right side of the heart, in the right atrium, the heart receives deoxygenated blood from the body. This is blood that has circulated the body and used up its store of oxygen. This blood passes through the tricuspid valve into the right ventricle. From here, it gets pumped through the pulmonary valve into the pulmonary artery, which takes the deoxygenated blood to the lungs, where gas exchange allows it to pick up oxygen again. This oxygen-rich blood comes back through the pulmonary veins into the left atrium. The blood passes through the mitral valve into the left ventricle, which pumps the blood back out of the heart through the aortic valve into the aorta. The aorta is the main artery which takes the oxygenated blood to the rest of the body. Once the body has used the oxygen, it returns the blood back to the right atrium of the heart and the process starts again. Inside a healthy heart, there is a partition called the septum, which divides the heart and prevents oxygenated and deoxygenated blood from mixing. Every time the heart beats, the valves in the heart open to allow the blood to flow in one direction. They then close to stop the blood from flowing backwards. It is these valves which make the classic heartbeat sound. Now we will look at some of the conditions that can affect the heart. You can see here how blood might flow through a normal, healthy artery. Heart disease is the term used to describe a wide range of medical conditions associated with the heart. It is most commonly used to refer to a build-up of plaque, a fatty substance that is deposited on the walls of our arteries, causing some narrowing. Angina is the narrowing or blockage of the arteries, partly due to plaque build-up causing restricted blood flow. When we are subjected to stress or exercise, vasoconstriction or narrowing of the blood vessels occurs. This makes it harder for the blood to flow through the already restricted artery. If someone is suffering from an angina attack, we should encourage them to rest. With rest, their symptoms may subside as the blood vessels relax back to their pre-constricted size. Angina shares many of the same symptoms as a heart attack, but usually gets better with rest and/or medication. The medication used to treat angina is called glycerol trinitrate, or GTN, which is a spray administered under the tongue. GTN causes vasodilation, dilation of the blood vessels, including the coronary arteries. This makes them temporarily bigger and allows the blood to flow more freely. This, alongside rest, should help to relieve symptoms. If it does not, we should consider that this may in fact be a heart attack. A heart attack is a blockage in a coronary artery from a clot. Most commonly, this is caused by a piece of plaque coming away from the artery wall and getting stuck in the artery, causing blood to clot around it and create a blockage. This stops blood flow past that point, which leads to part of the heart muscle not getting sufficient oxygen and therefore starting to die. This is a medical emergency and requires treatment in hospital. So to summarise, Heart disease is characterised by a build-up of plaque in the arteries. Angina is a condition where the arteries are narrower and blood cannot get through as easily as it should. And heart attack is a complete blockage of the blood vessels in part of the heart, causing part of the heart muscle to die. After introducing heart attacks, ask your trainees to name some symptoms. They may include nausea, a vice-like chest pain, body aches, particularly in the left arm, jaw or upper back, shortness of breath, cold clammy skin, a greyish-blue skin colouring, and a sense of impending doom. But there are many more. Remind your trainees that not everyone has the same symptoms. Remind them to keep their casualty calm, call 999 or 112, and be prepared to resuscitate. Many of the symptoms of angina are the same as a heart attack, but will usually get better with rest and/or medication. A cardiac arrest is when the heart has stopped. This can be due to a heart attack or many other conditions. Symptoms prior to a cardiac arrest can be remarkably similar to a heart attack or angina, though often include palpitations or abnormal heart rhythms at the onset. But a cardiac arrest will cause the heart to stop beating, so symptoms will progress to cause unresponsiveness and the casualty to stop breathing or to stop breathing normally. They may also make gasping noises called agonal breathing. CPR must begin as quickly as possible once a cardiac arrest has been identified. So to summarise, a heart attack is a circulation disorder where the blood cannot circulate effectively due to a blockage. A cardiac arrest is where the heart has stopped beating. Both of these are life-threatening emergencies.